Round up a posse, it's the Medicare for the Lazy Man podcast. The porta potty of Medicare podcasts. He sips tea with his pinky finger extended. It's Medicare expert Doug Jones.
Well, hello, everybody. This is your Medicare expert, Doug Jones, and I'm here to help you feel really, really good about Medicare. It's a subject that is larger than life and scarier than it should be. And it's one of these things that people just sometimes need a little encouragement in order to feel good about. And I'm here to help you with that encouragement. The way I do that is to encourage you to look at my books, mostly on Amazon. I've got a great paperback available on barnesandnoble.com. But if you're an Amazon shopper, what you do is type in the title of the book. The main book in the collection is Medicare for the Lazy Man 2025. Don't get the 2024 version. Don't get the 2023 version. Don't get the 2022 version, and on and on and on back to 2018. They're all on sale at Amazon, but you want the 2025 version, and you will learn all there is to know about Medicare. It's not a long, ponderous read like some of the books, like Medicare for Dummies, as an example. That is a book that sells tons and tons of copies every year. But Medicare for Dummies, surprisingly, is better to use as a research book. It's like the encyclopedia of Medicare, but it's not something one would read cover to cover to learn about Medicare. It's over 4 times, it's almost 5 times as long as Medicare for the Lazy Man 2025 is. And it's chock full of important information, but it's the kind of stuff you use for research. So go to barnesandnoble.com or go to amazon.com and type in Medicare for the Lazy Man 2025. You will have the ideal book to teach you the things you need to know about Medicare. The nuts and bolts of Medicare are all contained in that book, and it's like 100 pages long. A couple of stiff drinks and you'll be through it, and you will become an expert on Medicare, whether you want to or not, just by absorbing the knowledge within that book. Now, Medicare drug plans, that's another subject of Medicare. I have written a book to allow you to become an expert in selecting your own Medicare drug plan. And the name of that book is Medicare Drug Plans, ironically, a simple DIY, something or other guide. I believe that's what it says on the cover. So it will teach you how to pick your own best drug plan. And that book is going to be useful this year as we're coming very close. By the time you're listening to this, it'll probably be the open enrollment period that happens every fall, where you can sign up for a new or different drug plan that will start in January. So that is a resource for you to keep in mind. That's going to be a $10 item. I have cut the price to that down to what Amazon charges me to make it available. Amazon demands that I pay them for the cost of printing the book, and they demand that you pay for the shipping of the book, but I don't get any royalty, any profit from that book, because I want everybody to pick out their own best drug plan. It's a $3 item if you use the Kindle option. So if you've got a Kindle reader that Amazon supports, get the $3 version, and you can match your actions on the government website to select your own plan with the pages in the book. And eventually you're going to have your own plan at a very modest cost, at least the best cost available considering the drugs you take and your location. And then finally, of course, we have the slimmed down, the very, very short and to the point Medicare for the Lazy Man Bare Bones. It says Bare Bones right on the cover. This is a Medicare enrollment tutorial. It's probably got 20 pages of instruction, and the rest of the book is just boilerplate fol-de-rol and a little biography of me, just so you know who you're dealing with. But most important, it tells you how to enroll in Medicare Part A, Medicare Part B, and it tells you how you and I are going to decide together what your preferred Medicare supplement plan will be. And then finally, it will guide you to the various sources available to pick out your own Medicare drug plan. So, those are the three books that you should be looking for when you go to the Amazon bookstore. And what am I looking for every time I start one of these podcast episodes? Well, that would be Mr. Randy Carson, because he's the guy who makes this thing work much better than I ever could. And so I'm always happy to see that he's up and about and ready for another episode. Randy, it's good to see you out there again. It's a special day in Arizona because you just had a big rainstorm, didn't you?
Oh man, I'm going to tell you that was I mean, obviously we like having rain. We have to get rain, but my dogs were reasonably reluctant to go out, so I had to get up several times over the night trying to catch a dry spot in between the squalls.
Oh boy.
And it was a long night, but I love my pups, so what are you going to do?
Yeah, I guess they once you spoil them, you're kind of trapped in that merry-go-round of doggy care, I suppose, right?
Oh yeah, yeah. They're good. They're good kids.
Well, good. I'm glad to hear
So
it.
what are you up to out there in the land of Pugsley?
Well, we were going to leave. Mary's very anxious to get back to our home in Arizona, and I am too. And the weather has been fantastic here in Illinois. I can't imagine why, but it was 80 yesterday, and it's 80 and humid here. It's like 100 and not humid in Arizona, but equivalent comfort factor. You and I
Right, right.
never complain about that sort of temperature. Um, but Mary keeps accepting social engagement dates, and so our departure from Illinois has been pushed off to probably the 1st of October. So I don't know when this is going to air, but probably be driving by the time we'll be able to listen to it. So we're going to be here longer than I expected to be, but it's allowing me to go through a bunch of boxes of stuff and try to get rid of as much stuff, because when we eventually make the 100% move to Arizona, it would be silly to move stuff out to Arizona and then throw it away there. So
Yeah.
I'm trying to get a little more hard nosed than I normally would be, and throw away stuff in Illinois. We've got a dumpster sitting outside the house, and we spend a few hours here and there throwing stuff away.
Well, I have somewhat the same problem in that my third car garage
Yep.
is chock full, and I do mean chock full. When I was on the road and my daughter was a little tiny girl, I always used to bring her back teddy bear. Every trip, I'd bring her back a teddy bear, and those are all stored in what is a 50-gallon, it's a trash can, but it's a
55-gallon
plastic.
drums.
55-gallon trash can or
Yeah.
whatever it's plastic. And our whole garage is filled up with those, and they are filled in turn with stuffed animals. And you would think that my daughter would at least give me some break because I'd say, hey, can you come over and get your stuffed animals? No. Well, if I would really like to be able to get into my garage. I don't care. No, she's not that mean, but anyway, I always threaten her. I'm going to get a U-Haul over here and I'm going to say, "Okay, the U-Haul's coming, and if you're
Yeah.
not here to grab out the stuff you want, it's going." And
Yeah.
somehow or another, she knows that's an empty threat. So,
Oh boy. Well, somebody's got to convince her it's not, because someday you're going to want to get a GTO before you get
yeah.
too old to enjoy life, and it's got to be parked somewhere out of the sun. And that
Yeah,
third
you
garage
got
is
that right. You
so
got that right.
I urge you to lay down the law at some point. Now, at some point, she's got a 9-year-old daughter.
Yes.
Maybe that daughter would be the recipient of the bears, the stuffed animals. Is that possible? You could foist them off on her?
I think so. And ultimately, that's part of my plan, is to get Aurora over here and say, hey, I've got 453 stuffed animals, teddy
Uh-huh.
bears,
Uh-huh.
and wouldn't you like to have about 452 of them? And then Brenna would follow up behind me and beat me senseless with her
Oh,
purse.
oh yeah. Well, I have to say you brought it on yourself though.
I
Your
did.
your fatherly generosity has now come back to bite you.
Yes, yes, it has. You wouldn't
Well,
want some bears, would you?
you know something? If you can figure out a way to give me those bears when I'm not aware of it, they'll go right in the dumpster along with all the other garbage I'm
Oh
getting rid of.
man,
So
that's probably where they should end up anyway.
eventually they probably will, but you don't want to be the one to do it, I'm
No,
guessing.
I don't, because that would probably besmirch my fatherly and grandfatherly reputation for the rest
Yeah.
of my life.
I understand completely. Well, my reputation is hanging in the balance here because by the time this episode is aired, and I don't know exactly when that's going to be, it'll be time for people to worry about their drug plans. And what happens every year at this time is that there's a thing that most people called open enrollment. I call it AEP, annual election period, but it's a period of time that the government has set aside to allow people with Medicare Advantage plans and Medicare drug plans to take a hard look at their current plan and decide whether they want to keep it or whether they want to swap it out for something else next year. The primary purpose for this was because Medicare Advantage plans, people got sick of them and they needed a relief valve. And the relief was that, okay, we'll give you a time each year to get out of your Medicare Advantage plan and you can try some other Medicare Advantage plan, or you can go back to regular Medicare if you want. And then, of course, there are some people who fail to do it during the annual election period. And so, what do? The government said, well, these people are going to have a revolution and overthrow the government if we don't give them another safety valve or relief valve. And so now, the first 3 months of each year, you're allowed to make one change. But in this period of time, from October 15th to December 7th, you're allowed to make as many changes as you want in your Medicare Advantage plan. And you can go back to regular Medicare if you want. And you can also make a change in your drug plan because a lot of drug plans are making changes of their own. And it's just entirely possible that the drug plan will not be the best for you in the following year. So, I'm going to start this episode with a short Medicare Advantage minute, and then we're going to go into a very short little Your Medicare Benefits 2025. And then I'm going to spend the rest of the episode letting you know what the options are, your best options for picking out a new drug plan that you will have from January 1st on if your current drug plan is not going to be the best bet for you. So let me start with the Medicare Advantage Minute, and it will be about, let's see, now where did I put that thing? It will be, you would think I would be better organized, wouldn't you? Oh, yes, here we are. Medicare Advantage legislation in Congress. There are 8 bills in Congress. People are grandstanding, I would think, in most cases, because they hear the unhappiness out there. They've heard the complaints that their constituents have filed, and they're not happy about it. And so many people in Congress are filing legislation that they're hoping will be passed or at least given serious consideration. And there are 8 bills right now that you should know about. The first one is Medicare Advantage Prompt Pay Act. Now, often these bills that they work on, whatever the particular subject matter, have silly names, and so they like to make acronyms. In this case, the thing is MAPA, Medicare Advantage Prompt Pay Act, and it's supposed to ensure more efficient Medicare Advantage payments to doctors. Uh, Under the legislation, insurance companies would have to pay electronic claims within 14 days. I guess that's news to these insurance companies who drag the payment out as long as they possibly can because they earn money every night when they have cash in their bank accounts. So anyway, if the provider is in network, that's the goal, 14 days for an electronically filed claim. They would have 30 days for all other claims. The second bill that you should know about is called the Prompt and Fair Play Act. And this would require Medicare Advantage plans to reimburse services covered by traditional Medicare at the same rate as the Medicare fee schedule. It also establishes requirements for Medicare Advantage plans to reimburse providers within 14 days for claims submitted electronically. The third one is called Apples to Apples Comparison Act, and this would require the government and the Medicare Payment Advisory Commission to report more cost comparison measures for Medicare Advantage and regular Medicare members. Now, here's the one that bothers me, and I should ask Randy if he knows who David Schweikert is, an Arizona Republican. He's a representative. He's not a guy that crossed my radar screen, but then I started hearing things about him, and I heard that he was a conservative guy, somebody that we might consider supporting. But this bill reared its ugly head, and I reported on it a few episodes ago. It is an act. It's just got a number right now, HR 3467. The bill would require Medicare Advantage plans to pay capitation payments for most plans. That's not the scary part. Here's the scary part. It would allow the government to enroll people like us, Medicare participants, especially turning 65, in the least expensive Medicare Advantage plan available to them automatically. Then, of course, the final sentence in the description is enrollees could opt out of this option. I don't know what's wrong with this guy. He wants to shove people into Medicare Advantage plans and make them actually take action to opt out of Medicare Advantage plans. That seems counterproductive to me when the object of our efforts is to allow people to have more freedom of choice. He is on the side of less freedom of choice, and that's very disturbing as far as I'm concerned. I'm hoping that this bill gets squashed like the bug that it is. It would also require Medicare Advantage plans to administer the Medicare hospice benefit. Currently, when Medicare Advantage people enter the hospice care, traditional Medicare manages these benefits. The National Alliance for Home Care called the proposal short-sighted, and I'm inclined to agree. I don't know of any reason why it's not short-sighted. The proposed carve-in, it's not a carve-out, it's a carve-in, seeks to solve a problem that does not exist, upending hospice as we know it and subjecting dying patients to new administrative hurdles, reduced choice, and the risk of diminished care. Well, I'm all in favor. I agree with all of the elements in the criticism of that particular thing. So I'm hoping Schweikert's bill goes down to defeat roundly or soundly. Another piece of legislation that we should know about, and this I think is important and I support it wholeheartedly. It allows the Department of Veterans Affairs to bill Medicare Advantage plans for reimbursement for the care provided to Medicare Advantage plan members. It's designed to close a loophole that allows Medicare Advantage plans to receive payments for veterans enrolled who are receiving care entirely through VA facilities. Now, if in case that didn't seem clear to you, if you've got a person who is covered by the VA and they choose to be treated by the VA, the Medicare Advantage plan that they might be enrolled in is still getting reimbursed for having that person as a member. So the government is forking over, let's say, $1,000 a month for somebody who never uses their plan. And it's like if I'm a Medicare Advantage plan owner, I'm going to go around to everybody at a VA hospital and say, look, you guys like the VA, sign up for my Medicare Advantage plan. I'll never talk to you. You won't even hear from me, but I'll be collecting tons of money from the federal government, your tax money, ladies and gentlemen. So then that, I think, is something that really should be supported. There's a No Upcode Act. That would require the government to use 2 years of data in its risk adjustment methodology. But more importantly, it would prohibit them from using diagnoses collected from the health risk assessment, I want to say spies, the people who go out from the Medicare Advantage insurance company and fill out dubious questionnaires in order to gin up the amount of money they can get from the government when they falsely show that a new member of their plan has all kinds of medical problems that are going to cost extra. They go to the government and say, hey, reimburse us for the extra risk this patient represents. And the act that is being proposed here would prevent that from happening. So I'm all in favor of that. And here's one where we're going to try to pronounce the acronym Stopping Medicare Abuses to Restore Trust in Healthcare Act. And I believe it's going to be SMART. Stopping Medicare Abuses to Restore Trust in Healthcare Act. This act would require the government to, it's pretty much the same as the one we just described. And finally, the Improving Seniors Timely Access to Health Care to Care Act. So this would be ISTACA. This is a bill that aims to streamline the prior authorization process for Medicare Advantage enrollees. So that's another one that I would support because Medicare Advantage is a big pain for those who are covered by Medicare Advantage plans, and the plan is not real cooperative. That's one of their big excuses, the prior authorization. Now, what do we have for our Medicare, your Medicare benefits 2025? We have prostate cancer screenings. Prostate cancer is a big deal for a lot of guys, and apparently that can sneak up on you. There are different kinds of prostate cancer, some more insidious than others. Part B, as in Bravo, of Medicare covers digital rectal exams and prostate-specific antigen blood tests for men over 50, starting the day before your 50th birthday. How often? Once every 12 months. What are the costs? Well, for the digital rectal exams, after you meet the Part B deductible, you pay 20% unless you are smart enough to go to Doug Jones and get a Medicare supplement plan. In a hospital outpatient setting, that's where it would be conducted, and you might have to pay a separate hospital visit copayment, but not if you went to Doug Jones and got a Medicare supplement plan. For the PSA blood tests, you pay nothing for a yearly PSA blood test. If you get the test from a doctor or other healthcare provider, they always have to say that, and it doesn't, the doctor doesn't accept assignment, you may have to pay an additional fee for your doctor's services, but not for the test itself. So if you want to know more about this, go to medicare.gov/coverage/prostate-cancer-screenings. And now we get down to the meat, the nuts and bolts, the very important part of this particular episode. I'm going to read you the letter that is going out to everybody that I have an email address for. Just in case you're not inclined to read your email, you will have heard it here. And so if you're listening to this podcast because you've sent us your address and you want to be included when the announcements for new episodes come out, then we've got your email address and this will go to you. And I started out by saying, hello, everyone. We are up against the only time of the year that allows everyone to change drug plans for good reasons or for no reason at all. It is known as AEP, Annual Election Period, or more commonly, Open Enrollment, and it was designed to allow people to escape their horrible Medicare Advantage plans. It also works for those who have Medicare drug plans as well. Prudence dictates that each holder of a Part D, as in Delta, Medicare prescription drug plan take some action to ensure that the plan they wake up with on January 1st is the best plan for all of that year. No guarantees, but taking one of the following actions that I'm going to describe will vastly reduce the possibility of drug plan misery and unhappiness. There has been a lot of noise coming from the drug plan insurance companies about unprecedented trouble in paradise, so a defensive posture will serve everyone very well, even if things are not as bad as some of these companies are making it sound. If a selection of a new, more appropriate drug plan is going to be advantageous for you, the time frame is limited. You may only take action from October 15th to December 7th. I strongly suggest that even the laziest of my clients take one or more of the following steps. Number one, watch for snail mail from your current drug plan, and when it arrives, make sure you read it. The most helpful document will be the legally required ANOC, ANOC, which stands for Annual Notice of Change, and that should arrive in September. For years, I have ridiculed the lawyers who have made this document miserable to read and understand, but improvements may be happening. The Jones household has been fortunate to be able to enjoy one of the cheapest plans out there, the WellCare Value Script, which has a $0 monthly premium in most places in the U.S. and no deductible on any of the meds that I am forced to take. The WellCare ANOC arrived in mid-September, and I was very pleased to find a clearly written booklet that made the discovery process fairly straightforward. The two areas of concern will be next year's monthly premium and next year's formulary. Will the monthly premium increase to an unpleasant degree? Will all of your required drugs be covered by the plan's formulary? Either of these areas might have changed, and those changes might cause increased expenses in 2026. Your first line of defense will be reading the ANOC ASAP. Number two, do a search for the best available prescription drug plan, PDP, for your special circumstances that will begin on January 1st. What are your special circumstances? There are three variables that dictate your choice: your residence location, your list of prescription medications, and your preferred pharmacies. Each drug plan has a list of drugstores at which discount pricing may have been negotiated. In summary, your choice of plan for next year should be the one that allows you to obtain all of your drugs at your preferred pharmacies at the lowest price possible. The search method I suggest is using the federal government website, and I put the URL here in the letter in big blue print. It's www.medicare.gov/plan-compare. When you go to that website, you're going to see three ladies that are kind of giggling at each other. It used to be that there was a gentleman with a bushy mustache, and I referred to him as the Frito Bandito. But I think the government saw that I was making a little fun of their site that had not been changed in many years, and they took it upon themselves to make my description obsolete and take the Frito Bandito out of there and add the three giggling ladies. So anyway, go to the government website. If you do not take any prescription drugs and don't anticipate the need for any, your search will take about 60 seconds. Going to that site will be the hardest part of the work. Enter your zip code on the landing page. There are a couple of other questions to answer, and pretty soon you're going to be looking at the list of all available drug plans in your area. And the list starts out with the cheapest one. It may be like mine, zero monthly premium, and it will be that would be the one you want to choose. The cheapest plan available in your area is going to be right at the top of all the list of all the plans available. You'll find a green button on that entry that says enroll. So you click on that button and answer several questions on the screens that follow, and then you will be a member of that plan. Now, if you're already a member of that particular plan, if it turns out that your existing plan is the same one as the one that is suggested as the cheapest for you, then you don't have to do a thing, because your existing plan will automatically renew unless you take some action to interfere with that auto renewal. If you have a list of drugs and you go to that website, the search process is a little more involved, because you're going to have to locate each of your drugs with their accurate dosages in the government database And then you're going to have to tell the site which pharmacies are your favorites. And then adding those variables into the calculations is what makes the search a little more complicated and makes the use of a computer so helpful. It can be accomplished by almost everyone, but some hand holding is often appreciated. For this hand holding in your search for the best, that means the cheapest, drug plan, you may rely on one of two general sources. One of those sources would be an insurance agent or clerical staff that will perform the search for you after you have provided the necessary details. The risk of this method, almost all of these plans have stopped paying sales commissions to the agents, so many agents are turning away people requesting this free service because they don't want to go bankrupt. And that certainly applies to me. I don't want to go bankrupt. There's no pay in it for any agent anymore, and the companies have made that perfectly clear that they're quite happy with that. I don't see them helping people figure out what the cheapest drug plan is. These agents that I referred to literally cannot afford to do this for everyone who needs a service. Another risk of asking somebody that you don't know or that you don't trust to help you is accidentally, wink, wink, nudge, nudge, winding up in one of the very few plans that does pay a commission. There aren't many. And what if that plan is not the cheapest one for you? Well, then they will have tricked you into wasting money just so that they can get a commission for you being helped or asked to help. So I don't recommend that either. My suggestion is that you purchase my book. The title again of the book again is Medicare Drug Plans, a Simple DIY Guide. It's on sale at Amazon for either $10 for the paperback version or $3 for the Kindle version, and it will walk you through the process. You should find this a useful tool to select the best, cheapest plan this year and in the future, assuming the government doesn't do anything to screw everything up. Number 3, you can subscribe to a service to obtain a high degree of unbiased expertise. I only know of one such service, but I have confidence in their desire and ability to provide a great deal of value for their subscription charge. The elements that make this a superior level of service are too numerous to mention here, but using the link I've enclosed in this letter will take you to their website where you may find out more. If you subscribe using this link, you will also earn a $5 discount on your first annual subscription fee of $30. In the spirit of full disclosure, they will throw a couple of shekels my way if you use their service, even at the discounted rate. So the service is really not something you need to know about ahead of time because you won't be able to use it until after October 1st. But the URL is https://app.heymoe.com. That's HeyMo. I didn't name it. They didn't ask my opinion of the name. Anyway, after the heymo.com /agent/AGT4RQ5P. That gets you the $5 discount, and it gets you listed on their books as one of my clients. But the whole thing is that they will provide this service by checking even more things than I am able to check on the government website that I alluded to earlier. I think you will find this to be well worth it, especially if you take a lot of drugs or you have some complicating factors. And I'm hoping that you find, as I believe you will, that this is a valuable service. Now, the one thing I didn't mention in this letter that I'm happy to do for anybody, send me an email and I will give you that link so that you can check out their service and sign up for it if you want to do that. And the other thing I'm going to suggest is that you also send me an email if you want to have a list of websites that I've got that scan Canadian pharmacies. These pharmacies will ship formerly expensive drugs, but cut rate prices. And I'm told that the standards they're manufactured under are exactly the same standards as drugs that are available in the U.S. But I've got a list of websites that will search for your drugs at Canadian pharmacies that will ship to the United States, and it may help you save a bunch of money. So those are the two things that I should have mentioned more strongly in the letter. But with that, I see that I've overstayed my welcome. Randy's frowning at me. He has responsibilities he has to conduct, and I have stepped on his time a little bit.
Well, it's not only that, Doug, but they're beating on my door right now wanting more money, and I don't have any quarters.
I'm sorry to hear that, but I have an idea that you're pointing fingers at me and saying somehow it's my fault that the quarter machine ran out. And
Well, it seems to be that you have control of the board of directors. I don't know whether that's true or not, but that has always been my impression.
well, you're probably closer to the truth than I'd like to admit. So,
But rather than sit here and waste more airtime, I am going to say there's 3 or 4 things that I always need to do, and here they are. Grab your pencil, people. I'm about to give you an email address that could metaphorically save your bacon. And it is dbj@mlmmailbag.com, dbj@mlmmailbag.com. Write that down because you can use that to communicate with Doug, ask questions, make comments, or anything else you need. Next, Doug is licensed, as you might imagine if you don't know, nationwide to help you with your Medicare supplement choosing and planning. Check out the website, medicareforthelazyman.com. We would appreciate it in your wanderings through the internet if you could drop some good positive reviews for us. We're always trying to beat out the travel logs, and so far this year we've done very well. Last but certainly not least, thank you. Thank you for joining us. You could have been anywhere else doing anything else, and you weren't. You were with us, which is exactly where we love to have you, listening to Doug. However, you probably don't know how long you've been at this because nobody ever focuses on their watch. You have just spent about 32 and a half minutes with Doug Jones, the anti-insurance insurance guy, originally from Oklahoma. No more. Temporarily, he's living out in Pugsley land, and I want to get him back to Arizona as quickly as possible. So I went up to his house the other day to check out, his fortress of solitude, make sure it was in good shape. And I found a bunch of wild wolverines in his front yard that I had to get rid of. So
oh
I
my
did
God.
that. And now I'm going to go up there and make sure we've got rid of those. And so when he gets home with Mary, he doesn't have to fight the wolverines.
Well, I certainly appreciate that because Wolverines and the Nosebleed Indians, two of my nemeses. And so thanks so much for cleaning house for me. And thank you, ladies and gentlemen, for arriving at our podcast episode today. It's always a pleasure to have you with us, and we're hoping that you come by again for our next episode real soon. Bye-bye.